When it comes to AI, there's a lot of discourse around its potential to take jobs away from humans, but this conversation is a little bit different when it comes to the healthcare industry. And it feels a little different when you're talking about AI's entrance into a field like healthcare, because there simply aren't enough workers in the sector to get the job done, and the work needs to get done, right? And the workforce shortages in the healthcare industry are not predicted to get better anytime soon. In fact, they're projected to get worse because it's an aging workforce, right? There's more than 1 million doctors and nurses that are going to retire in the next few years, and there just simply aren't the young people coming into the workforce to replace them. Meanwhile, care demand and pressure on these healthcare providers is only going to grow as our aging population problem in the US intensifies. So I recently sat down with a healthcare leader at NVIDIA. NVIDIA is the chip maker and AI company that powers a lot of the AI infrastructure in the healthcare industry. And I sat down with Kimberly Powell, who is their vice president of healthcare, to learn how AI, and more specifically AI agents, might be able to step in and create a real solution, or a part of a solution, to what is a very real healthcare workforce crisis. And here's what she had to say.
There's two amazing things happening in healthcare right now that we are super excited about as we approach the end of 2025, where the buzzword of the year, I would say, is agents. We're seeing just an incredible transformation happen in healthcare services. If you think about it, World Health Organization says we're going to be millions of healthcare professionals short in just a few short years. And we know our doctors and our nurses are burning out, unfortunately, because we have a very high demand of healthcare services and not a lot of supply. And so this agent age of AI is really exciting in healthcare, because agents are a very different way of developing software. Software used to be tools that humans had to use. So you still had to have doctors use these tools. Well, these new agents that are being developed by a lot of amazing companies in this space are actually software that can go off and use tools and actually do work. And because of all of the amazing breakthroughs that we've had in foundation models, but moving into the tools and systems of agents that you surround foundation models with, like guardrails so they don't hallucinate, or the ability to recall modern medical knowledge, or the ability to call into tools that are a necessity to use to run healthcare, we're actually starting to build the opportunity for these AI agents to be hireable. And this is what's so exciting for healthcare systems. You can imagine now, it isn't the case that you can just go train up a whole bunch of doctors in the next 6 months and hire them. It takes longer than that. And so we need to do everything we can to free up all of our healthcare professionals that we do have today by hiring agents that can go off and do a whole bunch of other work on their behalf. And so I think we're starting to see this at the executive levels of large healthcare systems, where they're starting to see the light bulb of agents can actually become hireable in some really domain specific and high stakes environments like healthcare, because we have an environment of or an ecosystem of amazing companies that are taking their deep domain expertise and applying this amazing agentic AI and foundation model technology to problems that really, really matter and are going to move the needle in healthcare.